Watching a parent lose their mental acuity is a specific kind of tragedy. You see a sharp attorney or a meticulous pharmacist begin to struggle with simple logic, eventually diminishing into a shadow of their former self. The most painful moments happen when memory fades into an emotional disconnect, when the person who raised you no longer recognizes your face. It creates a deep, universal fear in their children of one day becoming a hollow burden to their own families. This demographic grid maps out the scale of the current epidemic. 1 out of every 9 people alive today at age 65 has Alzheimer's dementia. By the time that same group reaches age 85, the disease will capture 1 out of every 3 people. The sheer weight of those numbers creates a sense of paralysis. Many families simply accept severe cognitive loss as an unavoidable inheritance of getting older, rather than treating it as a preventable condition. The traditional medical model fails because it is reactive. Doctors typically wait for a formal diagnosis around age 65, but by that point, the brain is already functionally impaired. To fight this, pharmaceutical companies have spent billions chasing a single cure, developing $30,000 infusions that remove amyloid plaques from the brain. But these drugs clear the protein buildup while leaving the underlying biological triggers, the chronic infections and metabolic issues, completely untouched. The biological timeline of cognitive decline is much longer than most realize. It often begins silently in our 40s and 50s as subjective cognitive impairment. Those moments you lose a word, forget a name, or why you entered a room. Because Alzheimer's begins its work decades before a diagnosis, it is a problem for the middle-aged. Our best window for intervention is exactly when we feel the most healthy. We can now measure specific genetic risk using an APOE test. Inheriting the APOE4 allele from your parents flags a much higher genetic predisposition for developing Alzheimer's. People often avoid this test because they assume the results are a sentence they can't appeal. But identifying this gene allows you to customize your interventions, knowing exactly which inflammation markers to watch and which lifestyle changes are non-negotiable. This map represents Dr. Bredeson's approach. Cognitive decline isn't a single failure, but the result of 42 interconnected factors. Zooming in, daily inputs like high blood sugar, toxic mold, and viral infections trigger a cascading inflammatory response. By treating the brain as a sensitive, interconnected network, we can stop managing the late-stage symptoms and actually begin repairing the underlying architecture of the mind. The brain's natural defenses rely heavily on our physical biology. When women experience a sudden drop in estrogen during menopause, or men undergo a gradual decline in testosterone, the brain's protective structures physically destabilize. Physical trauma rapidly compounds this vulnerability. A history of traumatic brain injuries or repeated concussions accelerates the damage to these weakened neural pathways. Our muscles play a direct role as well. The aging process naturally strips away lean muscle mass, a loss that is often accelerated today by the rapid weight reduction seen with modern GLP-1 medications. Consistent resistance training and cardiovascular exercise counteract that loss while directly treating the brain. Pushing muscles to exertion releases brain-derived neurotrophic factor, or BDNF, a chemical compound that physically rebuilds the brain's neural pathways. Restoration also drives structural repair. Sitting in a sauna for 20 minutes, multiple times a week, increases blood perfusion to the brain, which helps clear out accumulated toxins and metabolic waste. Consistently lifting weights, optimizing key hormones, and prioritizing recovery routines are the physical tools required to override a genetic predisposition to dementia. To see how this protocol works in practice, consider a woman named Judy. Both her mother and brother died of Alzheimer's, and she received her own clinical diagnosis at age 65. Instead of accepting the traditional path of decline, she aggressively targeted her specific health markers using Bredeson's multi-factor protocol. Within months of changing her inputs, her cognitive function began returning. Completely free of dementia symptoms, Judy proved her physical and mental recovery by walking across the entire United States at the age of 81. Judy's story suggests that the cognitive decline many families view as a genetic certainty can, under the right conditions, be intercepted. This comparison illustrates the physical difference in how we process information over time. The structure on the left represents a young brain, acting like a fast, straight highway. On the right, an older, healthy brain develops a vastly more complex web of dendritic connections. While that dense web might slow down simple recall, it is the physical manifestation of wisdom, an intricate structure built through decades of experiential knowledge. There is an old proverb that says, "People perish for a lack of knowledge." Today, we possess the scientific information required to protect that wisdom, provided we intentionally feed our bodies and minds with proactive habits. True healthcare takes control before the symptoms appear. By addressing the 42 systemic factors that drive decline today, we can ensure our second 50 years are lived with full vitality, sharp function, and absolute dignity to the very last day.